Hi, everyone. I'm Josh Harris, Associate State Director for Advocacy and Outreach with AARP Illinois. Thank you for joining us for this conversation today, which is part of the Disrupt Disparities series of conversations in communities across the state. Over the last year, AARP Illinois has partnered with the Chicago Urban League, the Resurrection Project, and Asian Americans Advancing Justice and Loyola University to study racial disparities for older adults 50 plus in Illinois, especially in the areas of economic security, healthcare, and connectivity. Today, I'm joined by Akila McCord and Nicole Carter. Akila is the Chief of Staff at Bright Star Church in Chicago's Bronzeville community and of Bright Star Community Outreach, a 501c3 dedicated to youth and family anti-violence programs. Nicole, who will join us later, is the Chief Program Officer at Bright Star Community Outreach. It's great to be with you.
Thank you for having me, Josh.
Thank you. So why don't you just start? Just tell us a little bit about yourself and the work that you're doing in the community.
Absolutely. Well, I have been in nonprofit leadership for a little over 10 years now, working in a variety of capacities. My whole focus throughout undergrad, graduate school, and even in this PhD program is trying to build a more equitable reality for underserved communities. My work started about 3.5 years ago with Bright Star Community Outreach by way of program implementation and program management. I've been with Bright Star Church for about 2 years. I often tell this story. I never thought that I would be long-term with the organization. I came on to provide a means to an end, in a part-time capacity, but it took one staff meeting for me to listen to the vision and mission of Pastor Chris Harris, and it was over. I knew immediately that this work was necessary, that my position and place in my community, my Bronzeville community, was necessary, and that I was meant to be with the organization and with the church long term.
That's fantastic. That's an incredible story. And I want to dive a little bit more into your work, as a faith leader. You're a senior staff person at Bright Star Church and Bright Star Community Outreach. Can you talk a little bit about, as a senior faith leader, what role faith leaders like yourself have in advocacy work?
Wow. I feel as if historically that's just been what faith leaders do. Looking back to the amazing footprint of Martin Luther King Jr., right? He took advocacy to the next level in his role as a faith leader. I feel that faith leaders and our role in advocacy is integral. We have a knack for bridging gaps and bringing communities together for a common goal. And I feel that our mission as a church is to continue that methodology, to continue that fight, to continue in that work that our forefathers began. My job is to make sure that my footprint is left for the next, right? I take my faith to the next level by ensuring that I am aware of what my community needs. Not just by way of the church community or the 501c3 community, the community. I think that oftentimes there's a separation there as it relates to your faith-based community or your organization's community. No, if you're planted on the south side of Chicago, that's your community. It goes beyond the walls of the church. It goes beyond the walls of the organization. It bleeds into the tapestry of the actual community, the people, the youth, the children, the elders, I take that very seriously.
And as you mentioned at the end, the youth, older adults. So obviously our work at AARP is primarily focused on older adults 50 plus, but we really want to make sure that the work we do impacts everyone across generations. Can you talk a little bit more about your work and how it not just impacts youth, but also older adults as well?
Absolutely. Bright Star Community Outreach and Bright Star Church Chicago, we are intergenerational, right? Insecurities are unbiased, inequity, they don't have, a name on them. They don't have an age bracket or a gender. They are what they are. And as we seek to cultivate it and create a more equitable reality, we have to look at it from the entire gamut, right? Now, the work that we do as a church and an organization is family centered. I want to speak just a moment about one of our family strengths building programs with Bright Star Community Outreach. It's called GREAT, and it's basically a program that is geared to strengthening the family as a whole, right? It's not just the youth, not just the child that's within the 3rd through 6th grade demographic. It's not just mom or dad. It goes beyond that nucleus, because in order for us to really implement change, we have to go beyond those formal mom, dad, child parameters. We have to go beyond that and figure out where this is stemming from. A lot of the work that we do is centered at the feet of our elders so that we could help to envision a more cohesive approach in our work. I think that can't be done without us sitting at the foot of our elders. I think that it's necessary for us to be very intentional about the conversations that we have and very intentional about the approach that we have. And I think that Pastor Chris Harris and Bright Star Church Chicago, along with Bright Star Community Outreach, are very, very adamant about ensuring that those voices are heard and seated at the table as it relates to the planning, as it relates to the robust conversations surrounding change. We can't have those conversations without that demographic of people.
That's well said. Well said. And, I mentioned at the top of the opening of this about our Disrupt Disparities report. And, I'm sure folks who are watching this are probably wondering why another report, right? Why do we need to research what we already know? Well, as we went about our research, we discovered that there hasn't been a comprehensive study on racial disparities for older adults of color. So I'm going to read off some findings, and I would like your reaction. So in this report, we found that nearly half of adults of color over the age of 80 still hold a mortgage on their home, which is twice as high as their white counterpart. We found that Black older adults are more than 3 times as likely to live in poverty than their white counterparts. You have about 11.7% of Blacks between the ages of 50 and 64 who lack health insurance. And we found that more than a third of Black adults 65 to 69 do not have access to internet at home. What are your reactions? What are your initial thoughts there?
To be completely honest, Josh, it's appalling, but I am not surprised. I'm not surprised. I could pose a statistical question to your statistics. Why is it that under the guise of public education, there's a separation as it relates to quality education from the north side to the south side of Chicago? Why is it that one area underneath one umbrella of a school district, top in the country, can have acceleration in by way of math and reading, even with this disruption in in-person learning, but our areas like the south and west sides of Chicago, we're losing almost half a year or more at each grade level. But this is equitable, but this is, the same education. So it's not surprising, staggering, breathtaking, but not surprising.
Not surprising at all. Yeah, no, it is. And I tell you, as I went about it, it was, as you said, it was very breathtaking, but it validated what I already suspected. for the most part. And, you know, I think it's one thing for us to present a problem, to highlight an issue, to talk about what's wrong out there. But, you know, it's another thing to talk about what we're going to do about it. And that's why I was really grateful for the opportunity to speak with you and Pastor Harris and Nicole about this, because you all are doing the work in community to ensure that we are disrupting these disparities. So can you talk about the work that you and other faith leaders are doing right now to combat these racial disparities that I highlighted?
Absolutely. I feel that we're all very call and response. We keep our fingerprint on the pulse of the community, right? Pastor Chris Harris and his constituents and stakeholders and colleagues work together collectively to actively listen to the needs of the community and address them very strategically. You know, as I mentioned, Josh, it's no surprise that these insecurities are still present years and years and years after, you know, we thought we've made strides, and maybe not so much, very minor, if any. You know, what I found to be appalling is that, or not necessarily appalling, but eye-opening, is that the pandemic, COVID-19, it exacerbated all of these insecurities. It took our comfort zone of dealing with them and blew it up in our faces, right? And in the midst of that, you know, unease, you know, uncertainty about what's going on within our own communities. Because as you know, sir, we have been hit the hardest. You know, Black and Brown communities are hit the hardest as it relates to this pandemic. We have the highest amount of fatalities, right? And it's due to those insecurities. Lack of access to healthcare, that uneven playing ground, that playing field that we're in right now. And then even moving forward with some of the civil unrest as it relates to the senseless murders of George Floyd and Breonna Taylor, you know, all of that birthed an initiative led by Pastor Harris in connection with other faith leaders, other community activists, other stakeholders and constituents, to create a platform called Faith and Justice and Peace, or FIJAP. And it basically is a platform for folks to come together, to have the necessary conversations, to build the needed networks to go out and do this work, right? To go out and address how housing is an issue on the south side of Chicago, how not just affordable healthcare, you know, should be the top of our thought process, but access to it, right? We can't even talk about affordability if we don't have access. And so these conversations are hard, they're tough, but FIJAP, spearheaded by Pastor Harris, birthed out of that civil unrest and frustration of the insecurities, provides that platform for folks to talk, to have those hard and tough conversations, to build a framework to go out there and do the work. And we're right in the midst of that right now.
That's well said. Yeah, something that resonated with me that you just touched on is building the framework for people to go out there and do the work. And I'd like to take a moment to welcome Nicole Carter, who's joined us. Nicole is the Chief Program Officer at Bright Star Community Outreach. Nicole, welcome. How are you?
I am wonderful. Thank you for having me.
Thanks for being here. Why don't you just take a few minutes to introduce yourself and talk about your role and the work that you do?
Sure. So I am the Chief Program Officer of Bright Star Community Outreach. I've been a part of Bright Star for almost 6 years now. I help to make sure that our programs are measurable. They have data and evaluation components to it. Also making sure that the programs are answering the questions that the community is asking. We don't want to have any program that's just checking the box to say that we did it, but we want to make sure that we have impact. And I know that what we do at Bright Star Community Outreach is an outpouring of what Pastor Harris believes is important, the important work of the church. And so we end up being the arms and feet of the work that he's doing there. And so we're just really happy to partner to make sure that we're making Bronzeville better and being able to really, really affect the lives of our residents.
What is the community saying? You touched on making sure that you're responsive to residents in the community. So what are the top of mind issues out there that you're trying to address?
Sure, some of them are basic needs, right? I'm sure before I got on, Akila talked about how the pandemic and the social unrest really just exacerbated the problems that we already knew were present in the community. And so while we do the work of social services, people needed basic items. They needed food, they needed help with housing. So they're saying, help us. But also, they're saying, after this pandemic is over, what is my life going to look like? How am I going to get a job? Is that possible? And so we're really looking to support individuals in the world of work, which means providing training opportunities, linking them with certain resources that we have because of relationships, but making sure that post COVID that they're not re-traumatized. And so really setting them up for success moving forward, but at the same time, making sure that some of those basic needs are taken care of.
That's fantastic. That's great. And both of you actually touched on the pandemic, and I think it's something that we definitely need to talk about further. So we know that COVID-19 and this pandemic has highlighted disparities across communities of color. We know that about 96% of COVID-19 deaths in Illinois are from those 50 plus, but 18% of those deaths are from the Black community, even though Black people only make up 12.5% of the population in the entire state of Illinois. Specifically in Chicago, about 39% of COVID deaths are from older Blacks, with Black people making up only 37% of the population. So we definitely know that there are inequities across the board, whether it be economic or health or connectivity, you name it, right? But I want to dive into more. How has this pandemic impacted your congregation, your nonprofit? And then you touched on some things that you're doing to respond, but what are you doing in your leadership capacity to help those in need?
Keely, you want to start?
I will. I'll speak to how COVID-19 has impacted the church. I remember getting a few phone calls, back-to-back phone calls at the onset of this pandemic, and hearing Pastor Harris cry out about getting a call every day about a death, a COVID-related death, right? We have lost church members, our members have lost family members, children, loved ones, the list goes on. And what I can say is that, as Nicole mentioned, BSCO, or Bright Star Community Outreach, we do act as the arms and the legs of the mission of Bright Star Church, because that is Pastor Harris, right? We have collaborated and partnered on a plethora of initiatives to address those specific needs. When no one else was offering virtual homegoings, we were. When no one else was willing to collect and fundraise for those individuals, not a GoFundMe, but no, fundraise and go out there, foot to the ground, right? And advocate for those families. Bright Star Church Chicago, in collaboration with Bright Star Community Outreach, we were doing that. And we continue to do that. I spoke about creating that platform to build out that network so that we can come together and ensure that we are meeting the needs of the community collectively. We often say that we are not in competition with any organization. We definitely are the convener and not the competitor. We seek to provide resources by way of those networks and those partnerships, right? And Nicole, you could further speak to that as it relates to specific and intentional efforts from the Bright Star Community Outreach platform.
Yeah. So again, during COVID, it just really let us know that we kind of had to shift our focus a little bit. Programming was great. But sometimes people don't know your heart until they see your hand. And so it was really important for us to shift what we were doing to make sure that we were being impactful. So we switched all of our programs virtually. So we took everything that we were doing face to face and we made that available. But before that, we actually prepped the community to make sure that they were ready for that. So through several initiatives, we made sure that people had connectivity. We made sure that they had the necessary hardware so that they could be on this virtual platform with us. And then if there were some that couldn't do that, we made sure that we made telephone calls, good old-fashioned telephone, available so that we could stay in contact with them. We did not want that to drop. Another service that we have at Bright Star through our behavioral health department is our trauma helpline. And so we define trauma as anything that has an effect on you, period. It doesn't have to just be what you see on TV, the murders. All those things are definitely detrimental, but they're also light trauma that if unaddressed, it leaves you hopeless. And so we know that people's mental state was affected in exponential ways because of all of the things that have happened since March. And so our trauma helpline is a toll-free number that services individuals. It doesn't matter if the trauma happened yesterday or 50 years ago. It doesn't matter if you have any money or insurance, and there's no length of time that we will help you. So we found we realized a 56% increase in calls on that helpline since COVID. And so it's just amazing that we've been in a space where we've been able to help people across the spectrum, from, like I said, their basic needs to their mental health, to preparing them for the future. And so we've just been really intentional about making sure that we're providing all the wraparound services possible to the community. And so often there may be a client that came for one service, but we make sure that they're whole and we make sure that they're well, and we make sure that we connect them. And if we are not able to provide the service, then we provide a warm handoff, never a cold send off, because our community trusts us. So we need to put them in the hands of people that we trust as well.
You know, it's been, you know, we're about a year into this pandemic now, and there's still significant need out there, as you know, but it's also been amazing to see those like yourself and other organizations rise to that need and help people where they're at. You know, I want to dive a little bit into, you know, I talked about our report, the findings in that report, but also some of the tangible next steps we want to take. And now this is not, you know, the answer to every single problem out there. This is a first step, we view as a first step, and we know this is going to be a multi-year effort. But over the last several months, you know, we've been engaged with elected officials, with community groups, with foundations, talking about disparities. And we want to push legislation that's going to expand access to retirement savings through the expansion of secure choice, which will give many people across the state access to even think about retirement. We want to give homeowners some relief during this time. We know that, you know, whether you've lost a job or maybe you have some financial hardship, but even just getting some relief on your property taxes could be beneficial to you. And legislation around the expansion of telehealth. There are many people who may not be able to visit a brick and mortar doctor for whatever reason, but we want to give them the tools to be able, from the comfort of their home and safety of their home, be able to have a visit with their medical provider. And then, you know, they wouldn't be able to do this without high-speed internet. So we also want to expand internet access, specifically in communities of color. You know, this pandemic, and even before this pandemic, we've seen how you know, people have struggled just with connectivity, whether it be with remote learning or trying to schedule an appointment to get the vaccine shot, just because they simply don't have adequate internet or have it at all. So, you know, those are some of the things that we're doing as an organization in concert with others. But I want to get your view on, you know, what can viewers who are watching this, or maybe folks are listening, what can people do in their community to help move the needle on racial disparities? Nicole, why don't you start and go to Akila?
Sure. I think that one thing that we have to do is we have to agree that we need to come together. That's the first thing. And I think that we need to stop being in competition with each other and really come together to learn what we need to do to move it forward. I think that partnering with organizations, if they have the bandwidth to volunteer, everybody could use an extra hand at this point towards a common goal. I think that it's really important to dig in and to become a part of an organization that you believe in their mission. There's so many different opportunities out there. So Bright Star doesn't have the only answer. There's so many other programs in the community that can offer assistance. And it's so important that we support each other, in an effort to move the work forward. But I think it's also important to become educated on the issues. We don't want to go out and just be willy-nilly and be angry. Because if we're honest, all of these things, the disparities, the racism, all of the systemic inequities that are there make you angry. But anger is not going to move the needle. But becoming one band, one sound will help to move it forward. And then partnering. So if Bright Star partners with AARP, who partners with another CPO, then together there's going to be some strength in our collective voices. But literally, we have to know what the challenges are, what the real steps are, and decide that we're going to work together. I think that's just the beginning.
Absolutely. I share your sentiments wholeheartedly. I just think that it's important for us to be a team in this effort. Nicole always says, no big I's and little U's. We have to be willing to come together to have those necessary and tough conversations that will yield tangible results. Right? We just have to be willing. Bright Star Community Outreach and Bright Star Church welcomes partnerships, welcomes networking. We welcome those difficult conversations because they're necessary. They need to be had. And as I mentioned earlier in the conversation, it's time for that plan to be built out. It's time for us to get our marching orders and begin to do the work that's necessary and that needs to be done in order for us to see within our time, within our lifetime, an equitable reality.
That's right. That's right. Together, we can accomplish a lot. And I'm grateful for the both of you and Pastor Harris for our work together that we're going to do with AARP and Bright Star Community Outreach. I'd like to take a moment to thank you both for joining us and for this discussion. And thank you for the work that you do every single day to make Chicago a better place. I also like to thank Pastor Harris, the senior pastor of Bright Star Church and founder of Bright Star Community Outreach, for his work across Chicago. As I said before, our Disparities work, it's a multi-year effort. We know these challenges won't be solved overnight. We will have more conversations just like this with community leaders throughout the month of March and April. Our goal is to highlight these issues, put them on the top of mind for folks, so that as you're talking to your friends, as you're talking to your neighbors, as you talk to your elected officials, you are bringing to them issues in this report, but also solutions. And so, in fact, we're going to have a community convening in March with the Chicago Urban League and its affiliates. That'll be the next conversation we have. And then on April 26th and 27th, we're going to host a joint virtual summit with the Illinois Department on Aging with specific calls to action on state legislative action and also action that the philanthropic community can take right now. We're also releasing a second report later this year focused on social isolation, caregiving, and nursing home disparities. So I want to give you the floor, the both of you, to close us out and close us out with any final thoughts here. Keila, why don't you start?
Thank you. Well, first and foremost, thank you so much, Josh, for having both of us, for being willing to have this platform to create a safe space for us to stumble upon a brighter way and a better reality. Thank you for highlighting the work of Bright Star Community Outreach and Bright Star Church Chicago and Pastor Chris Harris. And thank you for having us here today. Thank you.
Sure, I echo those same sentiments. So just thankful, also grateful to the relationship that we've had with AARP and that we're continuing to have. I believe in partnerships. They're so important. As I mentioned, we can't do this alone, but I think absolutely we believe that we are better together. And so looking forward to how we're going to affect the community and especially the specific demographics that AARP addresses. I know that at Bright Star, of course, at Bright Star Community Outreach, we have lots of programs for youth and young adults. But as we get into the senior community, we have some, but to be able to really strengthen that through our partnership with you, I think it's going to be amazing. So looking forward to this work. Again, thank you for taking the time to talk to us and giving an opportunity to highlight the work that Pastor Chris Harris has done. He's an amazing visionary leader. We're grateful to be able to work with him and to partner with you guys. So thank you so much.
Thanks. And where can folks go to learn more about Bright Star? What's your URL?
So they can go to our website, www.brightstarcommunityoutreach.com.
Got it. Okay. Thank you very much. Thank you all. And as always, please visit aarp.org/IL for more information about our disparities work, vaccine information, or how you can get involved. Thank you.
Thank you so much.